Hello guys, in the last video we have already studied the brachial plexus. Now we will study the injuries to the brachial plexus. What will happen if injuries on brachial plexus? So studying injuries to brachial plexus. See, this is asked in many MCQ, so you have to know it. So we have two types of injury. One is ERBS paralysis. The other one is Klumpkeys paralysis. So you have to know the difference between both. Okay. Now first one is here in ERBS paralysis, the injury is to the upper part of brachial plexus. Here it is at the lower part of brachial plexus. Second important point is the root affected here is our, you remember the ERBS point, right? C5, C6. Here it will be C8, T1. Okay. Now this is also known as policeman or porter's tip deformity. Okay, or you can call it as waiter's tip deformity. You know why it is known as? Because now India everything is corrupted, right? If you are going to in a police station, I'm not talking about everyone. See, corruption is everywhere. So in the old days we used to give money to the policeman like through the back. So you can imagine the position in the ERBS paralysis. Or in the railway station you have porters or waiters, right? So you will give a tip. So they will take the tip as to the back. So you can imagine like that. So it will be easy to remember. Same manner in Klumpkeys paralysis, the hand will be like claw hand because the injury is to ulnar nerve. CAT1 is root value of ulnar plus associated Horner syndrome. See why there is Horner syndrome? Because in Klumpkeys paralysis, the sympathetic chain that is more related to what? Brachial plexus. So it is also getting damaged. So we have Horner syndrome also. To remember Horner syndrome, there is a simple mnemonics. What are happening in Horner syndrome? Remember sample, SAMPLE. Here S is for injury to sympathetic chain. A is for anhydrosis. M is for meiosis. T is for ptosis. Ptosis means drooping. Okay. Now L is for loss of sympathetic reflex because sympathetic chain is injured. E is for enophthalmos. Remember it is enophthalmos. It is not exophthalmos. Exophthalmos you can see in our Graves disease and all. Eye is bulging out, right? Here it is enophthalmos, that is going inside. So the MCQ people confuse every time Horner syndrome with E and A. This not hydrosis, it is anhydrosis, and here it is enophthalmos. Keep in mind that. Okay. Now in ERBS paralysis, the position, how the position of hand will be. The elbow will be extended. The forearm will be pronated. Supination and pronation, right? And the wrist will be hyperflexed. So they will ask you, wrist will be hyperflexed. The main thing you have to remember here is the shoulder joint or the shoulder position. Shoulder will be hyperflexed and adducted. Okay, shoulder joint will be hyperflexed and adducted. The main muscle affecting in ERBS is the brachioradialis muscle, as well as if they ask the nerve, the brachioradialis nerve. Okay, main muscle and nerve affected is, you can number it as 4. Brachioradialis muscle and nerve is affected. Okay, here I told it will be ulnar nerve because CAD1 this is the root value for ulnar nerve. So these are the main difference between Klumke's paralysis and ERBS paralysis. Now one more thing they used to ask. See this position, sometimes they used to ask the position also. We can this the shoulder, it will be hyperflexed and it will be adducted. Here hyperflexed in the sense there will be internally rotated. Okay, shoulder joint will be internally rotated and it will be away from the body, adducted. So imagine the position. Okay, elbow will be extended, forearm will be pronated and wrist will be hyperflexed. Now, so that's all about the main difference. Now they will ask you the cause. If they ask you the cause, you can, in ERBS paralysis, till here it is very important. Maybe they will ask you the cause. Okay, the cause is direct injury to neck and shoulder. And Klumke's paralysis, it is same direct injury to the upper part of thorax and axilla. Here it is injury to the neck of shoulder. Now next cause is that the undue separation of head from the trunk. It is commonly seen in what? The birth injury. While in the labor process there is known as some shoulder dystocia, that is during the birth injury. So it is a birth injury, common is this ERBS paralysis. It is commonly seen. Now here also the Klumke's paralysis can be seen due to undue separation. Same reason is also here. Undue separation of head from trunk. That is shoulder dystocia. It is seen in birth injury by delivering the baby. Okay. Now imagine you are falling from some height. So okay, you will, while falling, if you will try to catch something, right? So at that time maybe the Klumke's paralysis can be occurred. Okay, so you can write catching something to prevent fall from a height. So here the common complaint or common paralysis occurring is Klumke's paralysis. So these are the main difference between ERBS and Klumke's paralysis. Okay, so right, like in a terrace, your home terrace, if you are falling from there, you can just hold the slide or the sunshine. Okay, so that is to prevent the overhead fall. Just imagine. So at that time Klumke's paralysis can occur. The CAD1 root value can be damaged. Here one thing is undue separation of head from the trunk. So it is both ERBS can be seen also, Klumke's paralysis also can be seen. So this is an important topic. So go through this. It will be useful in solving many MCQ. Okay. Now we will do each nerve separately. for the damage of each nerve. Okay.